Hello and welcome to our Strangles lecture. I'm a Strangles ambassador, and on behalf of Red Wings and everyone else who's involved, I agreed to give a lecture. We're coming to you from Glasgow Vet School, which is in the northwest. As most of you know, I realise a lot of you will be locals. My name's James Risk, to those of you that don't know. I'm based in the practice. At the vet school, we've got a hospital and a practice. I'm lucky enough to be on the road with the support of specialists in the hospital. So we'll get started. One of the things I want to let you know with these live is that I'm able to see your comments and I can respond to them, and if you've got any questions. What I really enjoy is if you give me some likes to let me know that you're there. Without further ado, we'll get going. So this is me, just based up in Scotland, we've got our glorious hospital here, and actually it's managing to be quite sunny for the West Coast. So this lecture's on tips for disease prevention for horse owners and yard managers, and also for equestrian professionals. I know you know a lot about Strangles, but it never hurts to have a reminder, and it never hurts to hear the most up-to-date news. This is a quote by Dr. Andrew Waller from the Animal Health Trust a few years ago now, but it still rings true now. An increased understanding of key aspects of disease transmission and the improved diagnostics permit the implementation of basic management practices that can virtually eliminate, and that's eliminate, the risk of this disease. Here we've got a poor sad foal. It was one that was in Red Wings called Dancer. It tested positive when they had their large outbreak in 2015. Several of the horses tested positive at that case. Dancer was one of the 20% of horses that developed complications. Dancer survived, but it required quite a lot of intensive treatment. So, a very sad picture to remind us how important this is. So Strangles, why does it matter? Well, there's an up to 100% infection rate in horses with no immunity. And as Strangles doesn't carry very much immunity, the infection rate is generally high. It doesn't discriminate. It moves through the entire population, whether you have a very expensive, highly competing horse or whether you've got the love of your life that you hack every day. It can cause real suffering, and complications can be up to 20%. Now, complications can include hospitalization, intensive medical treatment, and sometimes in the extreme cases it can lead to death. About 7, and it's these carrier cases that we're wanting to concentrate on. So the good news, we can get rid of it. This is a more simple disease than the one that we're used to talking about at the moment, which is COVID. Research shows that everyone wants to be involved, and the fact that this has gone so far shows the willingness of everyone to try and move this case forward. And there are wider benefits from controlling strangles that lead to control of other diseases. So, what can be important? Obviously, it's equine specific, apart from very rare circumstances. Now, the important bit is that it spreads by direct and indirect contact. There's no death, but a very high morbidity, so a lot of horses feel ill. rate is quite low, but it still happens. And that's the important thing to remember, is that strangles is something we've all dealt with, but in some it resists and hides from the immune system, and as we go through, there are studies shows that it can persist, particularly in wet environments, damp, and there's been a study that importantly are the signs. Now I think the second one's the most important. So sudden fever, that's important to pick up, but depression, looking dull and uninterested. So as a practice vet, the first thing that would the first sign that I'd expect you to see that your horse was unwell was it be quiet. That would lead to looking for a temperature. And I suggest in any horse that's quiet, you should take its temperature immediately. You will pick up a lot of fever cases that way. Clearly, nasal discharge can be often yellow. Along with the fever and the temperature, you'll get anorexia, you'll get a reduction in appetite. So they'll be the back of their stable, probably being quiet, potentially with a runny nose, and not eating very much. And that's when you start to get your thermometer out and go looking for a problem. You can get swollen lymph nodes, and that's quite common. So under the jaw, that is, and sometimes sides, but generally under the jaw is where the lymph nodes are. If you've got a case that's gone quite bad quite quickly, you can get bursting of these abscesses, and you'll get pus coming out. Generally, by that point, it's a bit more chronic, and you may have a diagnosis by that point. Again, by the time it's a bit more chronic and it's been going on for a while, they can struggle to breathe. One of the nicest things you can do for a horse with strangles is to raise its buckets and raise its hay, because as they put their head down, everything gets tighter, and they struggle. So as part of the TLC, sometimes the vet will recommend that you raise their food and their water in order for them to more easily get to it. Asphyxia, where you get a complete closure of the airways, has been reported, but I've fortunately never seen that, and it is relatively rare. So this is where we go. Now, this is the difficulty. As you can see from the second picture, the pus goes everywhere in a real case. So it can be quite difficult to really properly maintain your isolation. And we'll go on to how we should best do that later on. Generally, they will need to be fairly close by. Some people turn them out in fields, and for relatively healthy horses, that's a way forward, especially if you don't have suitable buildings. But if they're quite sick, they will need to be quite nearby where you can keep an eye on them, keep checking their temperature, give them any treatments that they might need, and generally check for changes. The thing about strangles is a lot of it will be in the nursing. So the treatments that we're using may not be antibiotics, because sometimes we're wanting to encourage the abscesses and encourage the disease to progress. So it may only be anti-inflammatories. In certain cases, you do move to antibiotics, but often what you're needing is the immune system to do the work and the disease to work through. So some of these, TLC things, it's everything that we would expect. So a spacious stable, a full deep bed, good ventilation. Although the disease is not airborne, we've already discussed that strangles lasts a long time in damp conditions. So good ventilation and good lighting mean that things will dry up and we get less risk of contamination, cross-contamination. Plenty of full fresh water, and often raised. And again, we've got the raised food bowl. And it doesn't help these horses to be shut away in the back corner in a dark stable. You know, they need TLC. They're sick. They need people to see them, maybe groomed, you know, nice things, nice attention, not just shut away and shunned because they're infectious. So we've got the disease progression. The incubation length is important for determining how long we need to quarantine. And that's the first stage. In this time, infected horses should have begun to show signs, but they won't always. Healthy horses can go through a longer incubation period, and this is similar to our incubation period in COVID. It's that problem where you may have the disease, but you're not showing any signs. We used to do 14 days. That used to be our quarantine period, our period where a horse could be infected but show no signs. But we now go to 21 days, and that's because there are some cases that don't show themselves until that stage. Fortunately for us, fever is normally a first sign, and it can often be a sign that's shown before a horse is infectious. So if if you are very on top of things, and you catch your quiet horse at the back of the stable, take its temperature and get it isolated quickly, you can often catch things at that point. And that's a really important one. If there's one thing after this lecture that's worth doing, that's to get a thermometer. Once they're clinically ill, they're infectious, and they will produce a lot of pus and a lot of discharge that can be infectious. And in most circumstances, that goes on for 4 to 8 weeks. But as you'll see later, we have the situations that go on for longer. And what we've got to do at the end is to clear them, to prove that they're going to be okay, because they can enter carrier status. So what's a Strangles carrier? So the guttural pouches, and we'll see some evidence of these later, they are outpouchings of something called your eustachian tube or your auditory tube, which is a tube that connects part of your ear to your pharynx. And in horses, they have an outpouching. Horses have outpouchings everywhere in their sinuses. They have particularly big sinuses, and in their guttural pouches. And there are different theories as to why these are formed, but one of the main theories is to lighten the head. They've got a very big head, it carries a lot of teeth, it carries a lot of weight, and so any weight they can shed may help. And that's one of the theories. There are others. So these guttural pouches, these outpouchings in the back of the head, they're great because that's where Strangles can hide away. It's difficult for the immune system to access it, and Strangles can hide away there after an infection. So that pus forms in these guttural pouches as abscesses burst and things, and they don't drain properly. Then this pus can start to dry out. So it forms a sort of hard substance called a chondroid, which once they've been there for a long time look quite like pebbles. And they can be completely solid and smooth by the motion, and look like, 5 to 20 pebbles in the back of the head. The difficulty with these is these can store live, viable bacteria within them that at some stage may come out and may infect another horse. Carrier detection, Strangles carriers, is increasingly recognized as an important part of Strangles screening. And we'll talk through how we can try and find these and pick them up. There's an increased risk of shedding during stress. So sometimes that's when they get a virus like flu or a mild respiratory virus, and then they can then the stress, the reduced immune system can lead to the Strangles bacteria starting to be produced again and reproduce and start to emerge into the environment. I've got a short video here that I'll put on about what a Strangles carrier is, and you can have a break from my voice. So Red Wings have done some surveys on what horse owners think about Strangles and how much they know about Strangles. And one of the parts of the survey was that a large amount of owners who've had Strangles in their horses have had carriers that they haven't known about. And that's a really serious situation. And it's especially serious because we would hope that at that stage we could weed out those carriers. Some horses will be carriers because we didn't know that they even had Strangles. So there are still ways of producing carriers, but we really need to try and clear our horses at the end of an outbreak. And there's definitely a cost consideration, but we need to try and do everything we can to try and catch these at the end after they recover. So what are we going to do to try and stop Strangles moving between horses when we have an outbreak? So we've got our isolation checklist. Barriers and signs are really good. Not everyone on your yard or not every visitor will know about the Strangles outbreak. 10 feet is the currently recommended distance, and that's because Strangles doesn't move when it's in the air. It doesn't pass through the air. The Next stage is disinfectant. Now, most disinfectants will deal with strangles, but the most appropriate ones will normally list strangles on the back of the bottle as something they can manage and deal with. Some of the practical aspects are a bucket, measuring jug, sprayer, these sort of things. The way we clean our stables at the hospital is that once they're emptied and washed out between horses, they'll be sprayed down with a disinfectant. We use a garden sprayer. That's not necessarily horses that we deem are infectious, but it's just our protocol. So these garden sprayers can be really useful. Full length overalls. A lot of the sort of tool and equipment suppliers will have these paper overalls, and they're very cheap, and they're a very easy way to give a bit of added protection. You might still want to wash your clothes afterwards as well, but they're just another layer that you can take off. Disposable gloves, hand sanitizer, which we all have plenty of at the moment, is a good idea. You need to have your own tools, preferably ones that can be cleaned easily, so probably metal or plastic, and a thermometer that stays with each horse and doesn't move between. You're trying to do everything you can to almost run 2 yards. So with our outbreak management, the first thing we'll do is we will be swabbing horses using a great big long swab that goes back into their pharynx, and that will generally be the way that we pick up horses that have a fever and a runny nose and test them for strangles. If we're screening, the testing involved is often a blood sample. There are other things that we're going to go into that are potentially a little bit more invasive, but are also more accurate. It's this balance of speed and efficiency versus accuracy that we have with every test, with every disease. So that's what we'll need to work on. Again, our testing, we'll just go through this again. So physical examination at the very start or after the incubation period is a temperature and a runny nose. Those are the two big things. Our swabs, we've got, like I say, these nasopharyngeal swabs, which are sort of almost 50 centimeters long. They're quite something. Horses get a little bit of a shock, but they're actually very, very accepting of them. You wouldn't think to look at them, but they're not great at all for identifying carriers. We have a blood test. So this is testing the immune system. It's not testing for the actual bug. It's testing for whether the immune system it has been dealing with strangles in the recent history, in the recent past. It's a very easy test. It's moderately inexpensive, and it's quite good for when we're moving horses or when we're trying to deal with an outbreak with horses that may have been in contact. Our guttural pouch endoscopy, that's looking in these pouches in the back of the head, and that's the gold standard. You can see and you can collect exactly where you want to. It's a bit more invasive because the horse needs sedated, and we need to set up an endoscope to have a look, but it's certainly the most reliable. When they do have to get endoscopy, and they've had an infection and an outbreak and they've recovered, it's not always a one-off. So Red Wings use their example here of clearing out carriers, and this is at Red Wings. Probably about 50% they've cleared with one scope, but some of them have gone to 3 to 5 or more scopes in order to clear a carrier. And this is where, again, the cost comes in, and why the more we stamp out this condition, the better we'll do. So cost comes into this everywhere, but the important thing is the more we get rid of it, the more the cost comes down, and the more we don't let things enter our herds, the less likely we are to have these unexpected costs. There are some Strangles vaccines. There's one currently, and there's another one coming out sometime this year or potentially next year. The main trouble with the two of them, the current one, it's difficult to differentiate from the blood test. It doesn't have a huge length of action time. There is a development of another vaccine, and we'll have to wait and see how we join that to our Strangles management program. But again, it doesn't last a huge length of time, and that's our problem, is developing a vaccine that's really good but also really lasts us. So we're just going to recap. We've covered quite a lot here, so we're just going to recap and cover some of these points. So the main one to start with is Strangles airborne? The answer is no, and it's a common misconception. 37% of respondents to the Red Wings survey believed Strangles was airborne. And we're concerned that this could undermine people's desire to quarantine because they think it's not possible. But Strangles is a disease of contact and indirect contact. And so a 10-foot isolation, a 10-foot proper separation between other horses is adequate. A little bit further to be safe is probably wise, but it's not impossible for an awful lot of people. Can Strangles survive outside the horse? Yes. Research has shown that in dry environments it can last 1 to 2 days, but in cool, damp conditions, so the conditions that we don't really want to be keeping our horses in, but sometimes exist, especially here in Scotland, it can survive up to 2 weeks. So this is why a dry, airy environment is a good one for more reasons than just that we like it. Is it possible to quarantine anywhere other than a stable? Yes, it is, most definitely. And the thing about that is that not everyone has endless barns and facilities and stables. You can isolate in paddocks. The most straightforward and easy thing is to use several fences of electric tape, and then you can create this nice barrier area in between the quarantining horses and any other horses. How long should you isolate for? And this is where there's been a mild change in the past few years, and it's gone from 14 to 21 days. I don't know how many of my clients would be able to get this, but most of them are pretty good, to be honest. A fever is above 38.5 degrees. It varies a little bit depending on what textbook you read, but 38.5 degrees, if they're over that in 1 or 2 readings in 5 minutes apart or something like that, you can be pretty confident the horse has got a fever, and it's a good time to have a chat with your vet. How long can a horse remain infectious for? And that's a trick question. It's potentially years. We've got to clear horses because if they become a carrier, they can be infectious for a long, long time. There are no guarantees, and some of you will have kept up to date with the research, and the research is showing that the blood tests may not be able to work so long into the horse's past as we previously thought, and it probably isn't that great for picking up long-term carriers. And this is something that, as vets, we're all discussing frequently, and we keep on updating our guidelines as to what is best. This is where a multimodal approach is the most important, where our testing, our isolation, our monitoring horses, and our educating people as to what to look out for will all play their part in protecting from strangles spread and identifying carriers. It would be wonderful if we could endoscope and look in the guttural pouches of every single horse that moved, but it's not practical. So what we do instead is we use a combination of methods. And if we have a suspicion or a concern, that's where our endoscopy, that's where our guttural pouch scope comes in very useful. So again, we've got a nice little video here. Some of the have been really good and really shone a light on different aspects of the horse industry and how we can try and address these problems. And I think you know, the highlight from watching that video is the speed of action. If we can catch and act rather than think too much and worry that might be what we're dealing with, we might get away with having without having a problem. And I think we need to try and act quickly and not be so worried about what other people think, because if we act quickly, the episode might be almost quite boring, where maybe one horse gets strangles, maybe it doesn't, maybe it's just got another respiratory infection, something quite benign. We've isolated it, we've kept it out of the way, we've cleaned everything, and nothing happens. And boring is what I like. Boring is what we would love to happen all the time. So if we act quickly, we're more likely to have a boring episode rather than something that's too exciting and has a lot of disease spread. This is really just reiterating what I'm saying. Quick recognition, getting that temperature quickly, isolating immediately, not having your isolation filled with people who are coming in who are having a stable and trying to have it empty already. And if it's not, getting that electric fenced paddock in a field where we can move the horse to, if it's not too sick. Getting them there immediately and allowing everyone on a yard to know the protocol and where they can put their horse to isolate it. Diary records are a really sensible suggestion that some people do brilliantly, but a lot of people don't really do, and that's to keep a diary of the temperatures. I know one person who's got a blackboard in their stable, and that's where they record any significant notes like their vaccines and any temperatures if they've had to record it, if the horse has been colicking or anything like that. These things apply widely. Because when I turn up and you can tell me my horse started having a temperature this day or this time, then had a runny nose at this time, and then this happened, I can start to quickly add up what the disease might be, and I can more quickly act. And also, it often costs less because I can do things more quickly. I don't have to start from the very beginning. So there are lots of good reasons to do it. So the interesting thing is we've got a bit of a mismatch at the moment. 91% of people think that strangles should be more of a priority, but a lot of people don't have strangle screening in place at their yard. And that's where everyone needs to work together and try to encourage isolation and encourage a plan. And that's what Soul Week is all about, is getting everybody talking about this. So I would encourage you to take a pledge, no matter what part of the industry you're in. Take a pledge to stamp out strangles, to talk about it everywhere. And by talking about it, we will increase the awareness, we'll catch things earlier, and we'll start to bring this disease to a close because it's fully closable. There are schemes that are very smart because what they're doing is they're actively trying to promote good care. And if you were going to a yard that had something like the PASS scheme happening, where you know that the horses have been tested or being properly isolated, you can be confident that your horse is more likely to never get strangles, which is a fantastic thing and to be upheld highly. Some of the quotes by people who've had strangles or been involved in the industry have said, quarantining and blood screening policies have not hugely affected things. It's allowed the business to continue as it had, but it's increased the safety level for everyone involved. And the obvious question, why wait for an outbreak? One of the big things I find is that yards are getting bigger and bigger. And while we may have had horses on a yard where there were 5, 10, 20, and if you think about your 20%, that's maybe one horse with your significant complication. If we're dealing with yards of 50 or 100, which do exist now, your complications of 20% is more like 10 or 20 horses. And that's really quite serious. It starts to mean that a full-blown outbreak that's not quickly caught could lead to real problems for your horse. So what next? Just as we close up and I let you all away. So don't wait for an outbreak, be proactive. Ask your vet about screening and biosecurity. This is a very general lecture. If there's more specifics for your horse or your area, please do chat to your vet. They're very well informed. They'll have dealt with it a lot and they'll know the specifics of your area and your risks. Please take a pledge, mention it on Facebook, get people talking. We probably all have quite a lot of disinfectant and hand sanitizer, but just make sure that it's available, some's available at the horse. Have that thermometer. It's an inexpensive, easy purchase, and if your horse is quiet or out of sorts, let it get its temperature. Easy thing to do, quick way to catch any problems. So I really appreciate the time you've taken for listening. This has been quite a lot of fun to give. I've really enjoyed speaking to you all, and I see I've got some comments there I'll respond to just now. The thing is, strangles can be eradicated. It just involves us all working together. and I'm very pleased to be involved in Strangles Awareness Week. And then my last slide is just some of the contributors. It's been a huge effort bringing this week, and I have to commend Red Wings. They've done a fantastic job at bringing everyone together and doing this. So from me and Glasgow Vet School, I'd like to wish you a happy Friday, and I hope you have a great weekend. So thank you very much.